Okay, certification in general terms is a credential that is awarded to someone who takes and passes an assessment or a test, and these tests must have nothing to do with the assessments taken as part of a higher education certificate or degree program. Certification is meant to confirm that you have mastered and are competent in the required knowledge and skills necessary to perform a job. Certification has ongoing requirements in order to maintain the certification. Okay, I'm going to say it one more time just to be clear. Interpreter certification is not earned after you complete healthcare interpreting program at ARC or any other educational program or training program. Valid recognized certification for healthcare or medical interpreters is only earned after passing nationally recognized exam, either the exam that is administered by the Commission for Healthcare Interpreter, CCHI, or the National Board of Certification for Medical Interpreters exam. Both of these certifying bodies require an application process, and the purpose of that is to decide if a person qualifies to even take the exam. In order to qualify to take these exams, you must have completed an educational requirement of 40 hours minimum, show proof of bilingual fluency in English and a language of service. Okay, after the application process, you have to obviously pass the exam, which measures whether you have the skills and knowledge necessary to perform interpreting tasks while meeting professional standards. Okay, to recap, the primary focus of a certificate program is on education and training. The primary focus on professional certification is on assessment used as a screening tool to separate those who meet the assessment standards from those who do not. Let's talk about the credential requirements in California. In the state of California, a person can work as a healthcare interpreter without certification because it is not required by law to practice. Now, there is an exception, which is in worker compensation situations, which I'll talk about in a second. There's also no established educational requirement in order to work as a healthcare interpreter in California. So, since these two things are true, why should interpreters earn educational credentials or certification? Well, the reality is that while the state of California may not impose a certification requirement, providers of healthcare services, as well as other consumers who pay for interpreting services, recognize that there is a need for certified professional interpreters in order to ensure higher quality of service for both themselves and the communities they serve. They recognize that interpreters who have completed a robust educational program or are certified require less training, and in the case of certified interpreters, may not need to be tested as part of their hiring process. Both of these things cost money and take time. Because both of these things cost money and time, consumers who pay for interpreting services, and by that I mean the employers of interpreters or people who contract them, they can save time and money by hiring certified or trained interpreters who they don't need to train or test themselves. So in short, employers such as healthcare systems, hospitals, clinics, language service providers recruit and prefer to hire interpreters who complete educational programs or have earned national certification. And some employers even require it, even though it is not a state mandate. Language service providers and other organizations who work with interpreters on a contract basis prefer to do business with interpreters who complete robust educational programs or have earned national certification, because as a contractor, they are not able to train contract interpreters or offer any continuing education support. So, what is workers' compensation? Well, if a person has a work-related injury or illness, their employer is required by law to pay for workers' compensation benefits, including medical care paid for by the employer to help the person recover from an injury or illness caused at work. According to worker compensation laws, interpreter services must be provided during the following type of encounter: during depositions, appeals, board hearings, medical appointments, and medical legal exams. In order to be paid for in delivering interpreting services at a deposition or appeals board hearing, interpreters must be certified by passing the Certified Court Interpreter exam. Now, to qualify to be paid for interpreter services at a medical treatment appointment or medical legal exam, interpreters must be certified as well, but it doesn't necessarily have to be a legal interpreting certification. Doesn't necessarily have to be the Certified Court Interpreter's certification. An interpreter can qualify to be paid for interpreter services if they have National Healthcare Interpreter Certification, which means that they have either passed the CCHI or the NBCMI exams.